Hi guys, I was just looking through some old videos and I found this one from about 3 years ago now, where I talked about asymmetric genitalia and how it's a super common concern among folks, and in fact we see it in about 60% of women or people who are assigned female at birth, and so it's a very common concern I get. Is this normal? Number one, absolutely yes it is, and if folks don't like it, what can you do about it? And so 3 years ago, I promised you guys a follow-up video about that, and I'm going to finally make it today and discuss labiaplasty, which is the cure for this if it does bother you. So this is a super common patient I see here in my practice in Miami, Florida, and we get folks who come from all over the world with concerns about their labia. Asymmetric labia are a really common reason that people want to do this surgery, and frankly there are functional problems oftentimes patients describe that just having all that unevenness down there can cause problems during sex or hygiene. And the nice thing about labiaplasty is it's a very quick and safe procedure in order to deal with it. There's a few different ways described to do this surgery, and you have to make sure your plastic surgeon is experienced with it because it is quite nuanced. But for example, in this patient, I would usually go ahead and take out a triangle of tissue in order to reduce down that one side. And then depending if we're addressing the other side, we may trim the borders as well. And sometimes we will reduce down the clitoral hood closer to the clitoris so that the new anatomy is all very congruent and it looks as natural as possible. So typically this procedure takes me about an hour, give or take. The patient usually goes to sleep for it. We numb the area up while they're asleep to help with post-operative pain. And it tends to be a very comfortable procedure. And in fact, quite a few of my patients are able to do this surgery just taking ibuprofen or Tylenol rather than stronger pain medications. So usually we're addressing both sides. In most patients, we're going to reduce down both sides. Rarely we're addressing just the one side. And I have pictures of this patient's actual before and after results over on our website, www.gallagherplasticsurgery.com, so you can check that out. But it's an easy procedure, and yet it's a life-changing procedure for many of my patients, and one that we definitely love doing here. Typically, my patients take about a week off work, and then there's going to be some other restrictions in the weeks following surgery with regard to sex and riding a bike, certain activities like that. But typically not too much downtime involved with this procedure, and it is relatively comfortable.